Hello, my name is Paula Anderson, and I'm with Paula Anderson Coaching Consulting. And today I'm going to just do a brief lesson on evaluation management coding. So, if you are preparing for the Certified Professional Code exam, evaluation management is going to be one of the areas that you're going to be tested on. And so, ENM is a specialty that a lot of people don't really like, but ENM is a specialty that I really enjoyed learning, understanding, and then when I was a direct coder, I actually learned how to code and I coded ENM services. So, if you have your CPT manual, you can get that out, and I want you to turn to page one. And so, page one is going to give you your table of contents. So, your table of contents is a resource for you to use to help you to find things. Now, what I'm going to focus on in this video is just a few of the categories and subcategories that you will find on the CPC exam. So the guidelines are very important. So before you get ready to do any direct medical coding related to evaluation management, you do need to be familiar with the guidelines. Now, what I'm going to cover is just some of the categories and subcategories that will be found within the NM section. So the first category is going to be your office or other outpatient services. And so these are services for patients that are considered to be new patients, which means that they're coming in for the very first time or they haven't been seen within a 3 year period. And then you have established patients who've been seen within a 3 year period. So you want to make sure that you determine what type of patient it is before they're actually assigned a code. So when you go over to your office and other outpatient services, your new patient codes start with 99202, and then your established patient codes start with 99211. Now, the difference between those codes is going to be, of course, new or established, but also you want to think about how are they coded. So, evaluation and management services are coded based off of medical decision making and time. So, medical decision making is based on what is the clinical judgment that's being used in order to make a diagnosis. And there are four medical decision making. So, you have straightforward, you have low complexity, you have moderate complexity, and you have high complexity. So those are the four medical decision making levels that you want to make sure that you understand. Now, time is going to be based on the time that the physician spends with the patient. And so each one of these codes is going to give you what the time element is. So next, I want you to turn to the hospital inpatient and observation care services. So these are codes that you're going to use for inpatient services and then outpatient services. So outpatient meaning that they are in observation, they have not been officially admitted to, or they have not been formally admitted to an inpatient setting, but they're still in an outpatient designation. So this is going to be code set. So you have your initial, which means that you're seeing them for the very first time. And then you have your subsequent, which means that it's a follow-up visit or it's a progress visit. All right. The next category that we're going to look at is consultations. So consultations is going to be when one physician is requesting the opinion of another physician. So you have an internal medicine doctor that's actually requesting the opinion of a cardiologist. So in order for it to qualify as a consultation, then the referring physician, okay, he has to make the request, and then the consulting physician has to actually document that the patient was treated. So there has to be a report that's sent back to the referring physician to make it a consultation. If those qualifications are not met, then that means that it's not considered to be a consultation. So there are three words that you want to think about when you're doing a consultation. It's going to be request, it's going to be render, and it's going to be response. So you got to have some type of response that's submitted back to the referring doctor. The next category of services that we're going to talk about, preventative medicine. So preventative medicine deals with those wellness visits. So when you have an annual checkup, that falls under preventative medicine. So in the pediatric specialty, of course, you have children that go on an annual basis to get their wellness checks, and then they also get their vaccinations because they're trying to make sure that they stay up to date on their vaccines. So you have two categories for preventive medicine. So you have new patient and then you have outpatient. So new patient means that this is the first time they're being seen. And then you have established patient, I'm sorry, established patient, which means that they're coming back in because they've already been seen as a new patient. So sorry about that error. So one of the things that you want to do is you want to make sure that you can determine whether or not it's a new patient or established patient, and then you want to make sure that it's coded based off of age. So stay tuned for more videos from Paula Anderson Coaching Consulting on basic medical coding concepts.